Hello, everyone on the call. This short presentation is based on your ERR units, and it's just a short presentation to shed more light on the assignment that has been given to you. This is one of the components of your apprenticeship. So it's assumed that you're either doing a level 2 or a level 3 diploma in health and social care. All right, so the topic of this webinar today is understanding employment, responsibilities, and rights in health and social care. It could also be children and young people setting, and this is a level 2 award. So this unit will shed more light on your rules, principles, the regulations governing employment, where you work, your rights and responsibilities, the condition under which you will be working. It's an awareness unit, what you need to be aware of, what you need to be conversant with. You need to know the boundaries of your employment, and what is expected of you, and what you're supposed to expect from your employers as well. Okay. So we have learning outcomes. There are 5 learning outcomes for this unit. So as you walk yourself through this unit, you would find out that you'll be learning about employment law. You would also learn about the local policies, contracts, and agreed ways of working. So you would have policies within your workplace. There will be a contract of employment for you, and there will be agreed ways of working. You would also understand your role in the wider care sector. So whatever your role is, you would understand how it relates and connects to the wider care sector. Your 4th learning outcome will be career pathways in the care sector. So what other progression routes, are there within your sector? And finally, you'll be learning about issues of public concern in the care sector. So let's start with your first learning outcome, which is employment law. And looking into this learning outcome, it will help you to answer the questions for 1.2 and 1.3. So if you have received your assignment for EER unit 1.2 and 1.1, you'll be asked to list the aspects of employment covered by law, and you will also be asked to list the main features of the current employment legislation. So these are the 5 major aspects that you would discover that there is a law put in place within your employment. So there's data protection, anti-discrimination law, there's health and safety law, there are laws surrounding your rates of pay, working hours, and holiday. And there is also an employment law with regards to sickness at work. So I'm sure when you started your work with your employer, you would have been given maybe a staff handbook, an induction, or a file to sit down and read, which will have the policies and procedures of your company. And all these 5 aspects should be represented in your policies and procedures at work. So if you have the workbook, there would also be some information that you can read through about these 5 laws. However, the best bet is to actually get these policies, your work policies, and read through them, and then summarize them, and summarize the main points for your answer to 1.1 and 1.2. So why does employment law exist? Why does it exist in the first place? Well, there's a reason for the law, and as you can see, there is quite a lot of legislation surrounding employment. So why do you think it's important? It is there to protect you as an employee and ensure you work in a safe and fair environment. It also gives you the legal power to challenge your employer if you do not think this is the case. It also gives the employer incentive to have proper employment conditions for its workers or face legal consequences. Okay, so and there's more. It makes it clear about what your responsibilities are as an employee as well. You know, your employer is able to run their own organization properly and meet the customer needs of their own organization. And in health and social care, this means that employment law helps the employer ensure that their service users are being treated with care by all their workers. So it safeguards everyone, yourself, your employer, and also your service users. That's why this employment law has been put in place, so that everybody is taken care of and everybody actually has a right to a fair opportunity, equal opportunity actually. Okay. So where can you get more information and advice about these employment laws? So I believe that your employer would have given you quite some information about the policies and procedures within which you work. But if for any reason, you don't have access to them, maybe you weren't given a copy of your own, you might need to go back to your manager and find out where you can access this information. The good place to start with will be to ask your manager. And if you already know where the file is in your workplace, go there and look into the policies and procedures and go straight to the 5 main ones that we've talked about. If you're working within a very large organization, then you might want to access the Human Resources Department, which is the HR, and maybe you're a lone worker, you work on your own in the community, you don't go into the office, maybe the head office is quite far away from you. They might have electronic copies of your policies and procedures, and it can be emailed to you, or you can have a login details so that you can actually go through them again. There are other sources outside of your workplace with regards to employment law, which will be, approaching your trade union, Citizens Advice Bureau, or go to DirectGov websites. Okay. So that's the first learning outcome completed once you're able to do that. And the next learning outcome is the second main learning outcome, which is around your contract of employment, the terms and conditions by which you have been employed, and you need to understand these things. So what are your individual responsibilities in your current job? When you were employed, what responsibilities were you given? When you carry out the duties you are responsible for, you are following the agreed ways of working with your employer. So I assume that you would have received a job description that details exactly what is expected from you. This is what will be included in your agreed ways of working. So where can you find them? If you don't have a copy of your job description, and ask your manager. I'm sure they would have given you one when you started your work. It's usually a written document, for the specific role that you would be carrying out. For example, there will be a job description for a care worker or a support worker, or if you're a senior carer or a home manager, the job descriptions are different, and the list of duties expected of each one will be different. So you should have yours, and this will help you not to go out of the boundaries of your own job role, which is what we mean by your agreed ways of working. So what kind of documents can you actually access, to get your contract and to understand the agreed ways of working? So you need to look into some of these documents at work, and you'll be able to get the information you're looking for, your agreed ways of working. So go back to the policies. What is the agreed ways of working within health and safety, within data protection, equality and diversity, bullying and harassment policy? Go to the grievance policy to tell you exactly what is expected of you, and if there's any issue, what you can do in such an event. Your contract is also very important. The contract would have been drawn out, contract of employment would have been drawn out for you, and these contracts of employment will state what your working hours, will be. Would you be part-time or full-time, or, are you freelance? Whatever you are, your agreement was, it needs to be stated in the contract of employment. So where is the place you'll be working? What's the location? If you do go sick, what is your entitlement? What is your length of probation? Is it 3 months? Is it one month? And what's your notice period if for any reason, you need to move on or terminate your contract? This will be clearly stated in your contract, the kind of notice period you need to give. Maybe 1 week, is it 2 weeks, or is it 1 month, or is it 2 months? Okay, so have a look at your contract of employment. Also, get a hold of your job description. As I said earlier on, it will also tell you the agreed ways of working expected from you, from your employer. And that will give you an opportunity to be able to answer 2.1, and 2.5 correctly. So when you start working, your pay will be stated clearly in a pay slip. And it's important that you understand every aspect of your pay slip. It's not just about the money that goes into your bank account. Your pay slip is also an important document in your employment. This is the receipt you should receive each time you are paid by your employer. It should be information for you. So some people are paid monthly, so they will receive a pay slip monthly, and others may be paid weekly, in which case they will get their own pay slip weekly as well. So on your pay slip, these are information that you expect to see on your pay slip. It should include your name, your employer's name, your national insurance number, your employee payroll number, your tax code, very important. Okay. So, and there's still more to your pay slip that you need to understand. Okay. So your earnings need to be clearly shown, exactly how your earnings go. If you're paid on an hourly rate, then the pay slip will show the number of hours you have worked, plus the rate of pay per hour. This is needed to calculate your gross income for the month, which is how much you earn before tax. If you are paid on a yearly salary, then your pay slip will show your monthly earnings, and that is your yearly salary divided by 12 months. Any overtime you have done and the enhanced rate of this should be clearly stated on your pay slip as well. All earnings will be totaled as your gross pay on your pay slip. Okay, so I'm sure if you take a hold of your pay slip, you'll be able to understand what all these things, what they mean. And finally, the pay slip will need to show any deductions from your gross pay. So there might be a need for deductions, and these deductions include the amount of tax that you have been deducted, your national insurance contribution, any payments into pension schemes, and these will be totaled and taken away from your gross pay. This will be called your net pay, and this is the amount that you'll be paid. That's the amount that goes into your accounts. So for you to answer the question for 2.2, get a hold of your payslip, have a look at it, and tell us exactly what is on your payslip. Okay. So the next question that you would need to answer within this unit, you need to describe the procedures to follow in an event of a grievance. So firstly, what is a grievance? A grievance is where an employee may have concerns over over their employment, or maybe working conditions or treatment from their employer. A grievance procedure ensures that the employee can raise these concerns with their employer so they can be investigated and dealt with. It is similar to a complaints procedure, just a little bit different, that a customer or service user may use, but it deals with you as an employee rather than the people outside of your company. Okay. So just some examples of grievances which you will be expected um, to also provide examples when you're answering that question on 2.3. Take, for example, an employee is discriminated against, maybe by the employer because of your color, of your race, your age, or maybe there's a disability or gender. That's something you might want to raise. That's a grievance that you might want to follow the procedure for the company and allege these grievances. So you would need to know what your grievances policy says. Another example is the employee feels that their working conditions are not safe. So maybe you've got to do moving and handling or infection control. You don't have the right PPE. Whatever it is that you think the conditions by which you're working is not safe, you can actually put forward your grievances as well. So the employer is not giving the employee their legal rights to holiday or breaks, or pay. Having issues with pay at work, having issues with holiday or breaks even during your work. This can be put across to the employer, or you need to follow the right procedure. Another example would be the employer has breached the confidentiality of their employee. So you have given some information, you divulged information to your employer, and for some reason, confidentiality has been breached. This can also become a grievance, and you need to follow the right procedure. So when answering that question, get your grievance policy and procedure in your policies and procedures file at work so that you can describe the procedure to follow. What exactly is expected of you as an employee? What do you need to do? In some cases, if the policy might include you putting the grievance in writing, giving it to a designated person in your workplace, it will usually be your manager. The employer would usually invite you for a meeting or a discussion so that you can explain your concerns, and it will be investigated, and you'll be given, notice of when the response, when you will get a response. This response is usually in form of a written letter as well, and the final decisions that will be taken will be to rectify the issue would also be stated in the response. Okay, so I need you to look into your own grievance policy and state exactly what the policy says, the procedure that you're supposed to follow, and that will be the answer to that question. Okay. So details to keep up to date with your employer. So there are some details that you would have provided at the start of your employment, and you need to update your employer if there are any changes. This is to enable your employer to facilitate your employment. They need to continue to keep some of these details up to date. It is your responsibility to inform them if there are any changes in your personal details. These details could include your phone number, your address, your bank details, and any changes in name. Maybe you got married. You would need to inform your employer about this. Okay, so that would answer your question 2.4. Understanding your role in the wider care sector, which leads us to the third learning outcome. You need to understand your role in the wider care sector, and we want you to be able to express what your role is. So firstly, what is your role? And the question you would need to answer in your ERR unit is explain how your own role fits within the delivery of your service provider. So you would need to ask yourself some questions so that you can answer this question. What kind of care setting do I work in? Answer that question. It will help you to provide evidence of understanding of this particular question. And then on normal shift, what kinds of tasks do you do? Who do you see and work with during your shift? Ask yourself, do I have any special responsibilities that you need to carry out, particularly, e.g., maybe ordering the stock, fire officer, safeguarding officer, first aider. What's some other special responsibilities that you are doing? Okay, so what other duties do you do apart from your main role? Maybe you're a supervisor, you are the top you're a team leader. You don't do this on a daily basis, but from time to time you're in charge of one major duty or the other, maybe medication, or it could be on rotation. So describe your role and give detail to it. You can also take your job description and use it as a guide to answer this question as well. Okay, so I have a case study for you to go through, which will shed more light on how you can write your own, what your role is at work. So for example, one is considered this case study of Rema. So she works as a care assistant in a residential care home. Looking at her job description, it states that she reports to the beauty manager of the home and that she carries out the following duties. Okay, so she provides day-to-day support for people with dementia. She also provides personal care. She assists with moving and handling of residents, assists residents to eat meals. She documents the care that she has given in the care plan, attends all training provided by her employer. And Numera also considers that she has extra responsibilities. So she has been delegated by the manager of the home to organize the activities rota in the home for the residents. She's also a key worker for 3 residents and is involved with attending their reviews and developing the care plan with the support of the duty manager. Okay, so that is clearly a summary of Norema's role. So this is something we'll be expecting you to do, give your own summary of your role, including any special duties or extra responsibilities you might be holding. So these responsibilities will impact on your work. It will impact on the service users or people that you work with, and that's why you have the question 3.2 to answer. So you're going to explain the effect of your own role on the service provision. I want you to ask yourself some questions so that it will help you to answer this question properly. So how do you improve the lives of the people you care for? What would happen if you were not there to give the care? What is the effect when you do your job role well? And what would happen if you did not comply with good care practice on your job description? Okay, so think about the answers to this, and that will be the effect your job role would have on others. So let's look at Numera again and see how her own job role impacts on, her own role impacts on her work. Okay, so we'll use the same questions that you will be using, and we'll see how Numera thought the impact of her job was. So yes, how do you improve the lives of the people you care for? Numera thought that she has a massive impact. Though assisting them with their personal care, this helps to ensure they prevented infections. It keeps them clean, presentable throughout the day. She also considered that this has an impact on her residents, on how her residents felt about themselves. So this includes how they feel, do they feel dignified or well-dressed? What's their self-esteem like? She also thought that the contact she had with them was important, as well as she was their main source of social contact during the day. They probably live in a residential home, and this was their most important human contact, the carer. Okay, so she thought that the managers know how the residents were and also help them ensure they meet the inspection requirements when CQC came to do their inspection. You can see how important Numera's role is and the impact it makes on different people. It has an impact on the service users, has an impact on the employer, the organization, and even when they have inspections from CQC, Numera's job role is very important and it has a special impact. Other aspects that you would need to ask yourself, that Numera did ask herself, is what would happen if she were not there to give the care. So Numera felt that the residents' health would decline as they would not be getting regular food and would be prone to infections through not washing properly. She also felt that as she organized the activities for the home, if she was not there, no one would do any leisure activities with the residents, and this would make them feel low, very poor self-esteem, and it would look institutionalized as well. So in her role as key worker for 3 residents, it would mean that these people would not have a careful eye or someone to talk through the day-to-day problems so that these could be raised at reviews. Okay, so it's a great impact. What else did Numera consider? And you should consider this as well. So the effect when you do your job well. So Numera felt that when she does her job well, the residents are happy and health. They're in good health and they all have their needs met, both physically through the good personal care she provides and mentally through the activities she runs. On the other hand, what will happen if you did not comply with good care practice or your job description? And this is Numera's answer. She felt that the residents would suffer from poor care. There would be a real risk that she would be abusing them through neglect, making them more prone to infections, isolation, and institutionalized care. She also knew that she would be accountable for her actions to the deputy manager, and if found to be in breach of her job description, that she could lose her job. She also knew that in serious situations where she did not follow proper care, she could also be prosecuted for her actions. So you see, when you are answering your questions, you will be using the pronoun I, and you would say things like, I know that this is what will happen, and I know that this is how the service user will feel. So you personalize the effect of your job role on your work. Okay, and that would answer 3.2. So for you to answer 3.3, which is you describing your role and how it links to the wider care sector, you need to understand 2 aspects of your role. Firstly, how you support other agencies and care professionals you come in contact with in your work. There are other people that you work with. Maybe you're working with the nurses, you're working with physiotherapy, community nurses, maybe the OT, different people that you have to work with, the GP, the pharmacy, Who do you have to work with? These are the how your role fits into the wider care sector and how it impacts on and the link it has with other professionals. So you need to write about that, show your understanding, and secondly, how your care setting compares to other settings in the care sector. You know, why your own care setting is important in comparison to others. What's the link? You know, if you work in domiciliary care, how does that link with compared to the other settings? You know, are you helping people stay in their own homes longer and enjoy the comfort of their own homes? You know, what is the link with the other care sectors? Okay, and so I will use Nurema's case again. Um, what we would expect from you when you're writing yours, you know, you need to take into consideration that you're going to be writing exactly what is working, what applies in your own setting and your own job role, but just use Norema as a guide. So we are considering the two main areas, which is the other agencies and professionals that she works with. Norema considered that she had a lot of contact with local entertainment services in the area, as she contacted them regularly to organize activities for the residents. She also had regular contact with her three key residents, social workers, as reviews. Here, she was able to feed back information on the changes in care needs since the last review, so the social worker could organize the correct funding and package of the care of the service users. She also had regular contact with the GPs, the district nurses that came to the home to see the residents. She was able to give them information about the health problems of the residents and their response to ongoing treatment so that the GP and nurse can diagnose properly. Norema has also been interviewed several times by the CQC inspectors on several of their visits. She was able to explain the care given to the residents and demonstrate what the home was doing to meet the standards. So you see, um, that is describing what Norema does and a wider scope, the link she has with other agencies and other professionals. This is outside your colleagues at work. This is outside what you do with the service user. The other aspect that you need to look into is the link within other care settings in the sector. And in the case of Norema, she understood that she worked in a very small specialized area of the care sector. She recognized that the home she worked in was a residential care home rather than home care, you know, and they specialize in specific dementia care for residents rather than generalized elderly care. So, what sector are you working in? How does it compare to other sectors? Write your answer, and that would meet um, what you require to do for 3.3. Okay. All right. So, moving on swiftly, you need to be able to describe the main roles and responsibilities of representative bodies that influence this wider care sector. But apart from your manager, apart from other professionals and agencies, there are professional bodies, representatives that represent um, the sector. And you need to understand what their main roles and responsibilities are. So these are some of the representative bodies that we would like you to explore. Look into the Care Quality Commission, CQC. That's the website there. Skills for Care, you know, read about them. What's their main responsibility? You know, Unison, what's their main responsibility? And then the Health and Care Professions Council. Now, I know that some of you might be using the General Social Care Council as one of your representative bodies, but I need you to know that this has been replaced by the Health and Care Professionals Council, which is HCPC, and that's the website to explore as well. So the Care Quality Commissions, these are regulators for all adult care providers. They have inspectors that come to the care settings and assess the quality of the care that is being provided against the essential care standards that all care settings must comply with. Now, this Care Quality Commission, they actually have power to set action plans for care providers to provide their service, and also the power to close down care settings as well. Okay, you would also read about skills for care. You find out that they look at the skills needed in the care industry and help in developing qualifications for care industry. So all these diplomas, the national occupational standards, uh, getting funding for the sector, you will be expecting all this from the skills for care. Okay, so read up about them and state what their main responsibilities are. And Unison is the largest trade union for people working in care sector. Okay, as a trade union, they will represent a care worker in matters to do with employment, provided these care workers are a member. They also fight for the rights of people working in care to ensure there are fair conditions of work across the entire sector. Okay, so explore these representative bodies and provide your answers, what you discovered. So that brings us to learning outcome 4. Learning outcome 4, you need to understand the career pathways in the care sector. So there are a lot of groups of service users you may be working with at the moment. Well, maybe not all of them at the same time, but one of them. So you might be working with elderly care or dementia care, supporting people with learning disabilities. Are you working with people with mental health conditions? Or maybe childcare. Some of you might be working in the hospital, NHS, and that will be clinical medical care of people who are ill, you see. So there are different groups of people that you will be working with. However, the types of care sector that you work in is part of what can enhance progression. So there are many types of care settings that you can choose to work in. These people can be supported, these elderly care people can be supported in different kinds of homes. And these include residential care homes, or you might be working in a nursing home, hospital wards, or clinics, domiciliary home care, warden controlled buildings, supported living flats. And this characterizes the kind of setting that you are actually working in. And progression is about, it's not only about moving ranks, it's also about understanding the different types of service users. You can actually be working with elderly, and now you want to progress on to working with people with dementia, or you want to start working with people with mental illness. So progression is also about moving from a type of care sector to the other. Where do you get information about career progression? This will answer your question for 4.2. So you can speak to your manager, maybe during your personal development planning or your supervision sessions, appraisals. Speak to your manager. If you have a human resource department, that is also a good place to start. You can check the website for skills for care. Also, you can actually also access UCAS for understanding, university applications, what courses are available to you, what kind of degree qualification can you access, and finally look into NHS careers as well. If you're considering working within the NHS, then they will be the best career advice sector for you to gain information about the different roles within NHS. Okay, so expand your answer. Make sure you don't bullet point. You need to explain your answers. And 4.3 is really asking you about your next steps in your career pathway. You know, this is just a diagram that shows you the possible career pathway within your workplace. So maybe at level 2, you are working as a support worker, a care worker. If you are doing the level 3, you're probably a team leader by now, or a senior carer. Whatever role you are dealing with now, there is always an upward progression for you. So you can move from level 2 to level 3 and move to level 5, which means you should be a deputy manager or a qualified manager. At level 5, you will be doing you will be able to work as the registered manager. So these are next steps for you, which you can plan. Or is it in the next 3 years, what you want to become, the next 5 years, what you want to achieve, and that's it, how to answer your 4.3, the question for 4.3. So what is your next step? So not what is just available in the sector, but what is your next step? So now that you have some more information about your career opportunities in the care sector, do your own research, on the different options available to you. Have a think about where you would like to work, what kind of service user groups you would like to work with, and what level of responsibility you want to aspire to. Once you have considered this, then go ahead and answer the question for 4.3. Okay. So, and last but not the least of the learning outcomes, which is learning outcome 5. And learning outcome 5 is particularly about how you understand issues of public concern that may have affected the image and delivery of care services in this sector. So issues to do with public concern, issues of public concern in the care sector. So there have been in the past some major issues, and it's been documented so that we can learn from it and prevent such issues from occurring. Again, many of you would know of cases like Baby P, Victoria Climby, so yes, you're looking to identify what these major concerns were, these public concerns, and these are a few suggestions for you that you can choose from. The case of Baby P, Haringey Social Services, the abuse of people with learning disabilities at Winterbourne, view that was uncovered in the BBC Panorama program, or maybe the recent NHS Confederation reports into dignity of older people in care. Find the report at this website. There was an issue of the aging population set to grow larger than the working population in the next few decades. This will cause a funding crisis as there would not be enough taxes to pay for the care these people would need. So find all this information and choose to understand what the issue really was. Okay, so 5.1, you need to identify these issues. So you list a few and write a little bit about what you know about them. And then 5.2, you need to provide your own viewpoints around that issue. So you can choose one. And what I would want you to do is try and explain all the different sides of the arguments. Okay, so when you read about the accounts, these are some of the questions that can guide you on how you should answer this question, as in providing your own viewpoints. How do you think the people receiving the care felt about the situation? How do you think the families of the people receiving the care felt about the situation? How do you think the carers working in those care settings felt about this situation? And what do you think the manager's points of view would have been, about it? What do you think the regulators, CQC or Ofsted, if it were for children, what do you think their view on this issue was? So if you put all this information together, it will be sufficient to answer the question, how you outline the different viewpoints on the issue that you have chosen to write on. And for your 5.3, how the issue has altered public views of the care sector. So as a result of these concerns, they have actually altered the public views of the care sector. How has it, used these questions as well as a guide to answer that question? So what do you think the public's view of the care sector was before the issue you chose? What was it before BBP? And how do you think that the public see people who work in the care sector after this issue? Has the issue you research had a good impact or a negative impact on the care sector? What has happened afterwards? Is it now a positive impact? Are things now changed for the better? What has happened? What has altered? What has been changed? Do you feel how this issue was dealt with will reassure people about the care sector? So write the answers to these questions and it will help you meet 5.3. And finally, changes to the care sector as a result of the issue. So what has changed? Based on the issue that you're writing out, the issue of concern, what changes are being considered? Changes to the way inspections are done? Is it changes to infection control procedures? What are the changes? Is it changes to the way people are safeguarded? Who is proposing the changes? Is it the government, CQC, Ofsted, or charities? What impact will these changes have? How will it affect the work you do with your service users? Have the policies been changed in your care setting because of these issues? Will you now get more inspections? Do you need to follow better infection control practices? These are things, that mind jugglers that you can use to answer the question on changes to the care sector as a result of the issue that you explored, that you studied about. Okay. And so that brings us to the end of this presentation. Once you complete all the questions, on completion of the assessment, you would have achieved a certificate for the Level 2 award in Employment, Responsibilities and Rights in Health, Social Care, Children and Young People settings. So thank you for listening. If you have any questions, pop it at the bottom of this video, and I'll be sure to answer your questions as well. So I hope you complete your EER successfully, and good luck to the rest of your course as well.